Hello everyone, so this is Vanessa Quezon and I'm going to discuss about drugs. So first, let's define drugs. So what is drugs? It is a substance used as chemical or in making medicine that affects the body and mind and have the potential for abuse. Without advice or prescription from the physician, drugs can be harmful. So ang drugs, kung i-take nimo ni siya as gina-prescribe sa imong doktor or sa imong physician, kani siya dili ni siya maka-harmful sa tuang body. So kung i-abuse nimo siya og daghan kag mga kinatake ng mga drugs, ma-overdose jud ka ug mao na ang makakos sa na kanang mga sakit-sakit sa imong lawas. So next is there are two forms of drugs. First is the natural drugs and the synthetic drugs. So what is natural drugs? So natural drugs is a herbal concoction containing agent with neurologic effects similar to those or controlled drugs requiring a prescription. So ang natural drugs kay wala ni siya ginabutang na kahit na ano na chemicals, may nga natural lang siya like plants na ano. So sa next slide there are some example of natural drugs. So next is synthetic drugs. These are the chemical compounds produced in a laboratory. It could be addictive and pose a serious threat on the health of everyday individual. So, the synthetic drugs, kanang naa siya mga proseso na ginabuhat para mahimo siya og kanang drugs na maka-addict, kanang may ngana ginabuhatan na nila og kanang nagamitan na nila og mga machine para mabuhat ni siya na product. So, the next slide is the example of natural drugs. So, first is the opium. So, opium is a poppy plants create drugs that are known as opiates. Raw opium looks like a milky fluid that bleeds out, or dried poppies that are still a bun form. So next example of natural drugs is a marijuana. So marijuana is a very common drugs here in our society or in the whole world. So this one sa uban country ginahimo ni siya og medicine sa uban like kanang kaayo daw og mga sakit-sakit. So kung i-abuse ni siya, mahimo ni siya og drugs na maka-addict. So what is marijuana? So marijuana is a common drugs comes from natural cannabis plant. It is typical not mixed with any toxic substances before being consumed. However, if marijuana can be laced with synthetic and dangerous chemicals. So that is the two examples of natural drugs. So next, let's proceed for the examples of the synthetic drugs. So first is the cocaine. So cocaine is a very difficult to define because since cocaine is a coca leaves that is natural grown in South Africa. However, plant goes through a grueling process to become cocaine. So pag synthetic drugs, ginabuhatan ni nila og mga machine or mga laboratory para mahimo ni siya na product. So that is cocaine. Next example is the heroin. So heroin is derived from the opium poppy. So kaganina ang natural drugs kay naata example na opium poppy. So pag i-process na nimo siya, buhaton nimo siya sa laboratory, mahimo na siya og heroin. So creating this extreme strong synthetic drug requires adding chemicals, filtering, and cooking the morphine that comes from opium. So that are some examples of natural drugs and the synthetic drugs. So next part of this video is the type of drugs. So first is the depressant, the stimulants, hallucinogens, tranquilizers, the narcotics, and the inhalants. So first is the depressant. So what is depressant? These are the drugs that inhibits the function of the central nervous system and are among the most widely used drugs in the world. So, depressant kay ginagamit na siya sa mga para ano ka kanang ma-relieve imong stress ana. Next is the stimulants. So, stimulants are a class of drugs that speeds up the message between the brain and the body. They can make a person feel more awake, alert, confident, or energetic. So, these are the drugs na ginagamit sa mga artista para maging active sila, nakabuhat nila ilang mga activities na nakita sa tao na energetic japon sila. So murag kani ang drugs na ginagamit nila. So next is the hallucinogens. The hallucinogens are a diverse group of drugs that after a person's awareness or their surroundings as well as their thoughts and feelings. So mo ni ang ginagamit um, para ma-aware ang isa ka tao na ginatake nila ni. So next is the tranquilizers refers to drugs which designed for the treatment of anxiety, fear, tension, agitation, and disturbances of the mind, especially to reduce states of anxiety and tension. So, mo ni siya ang ginagamit sa mga tao nga na naka-experience og mga anxiety, kanang kahadlok, kanang well matulog sila, nang mag-anxiety attack sila. So, mo nila ang gina-take. Next is the narcotics. Narcotics are also called as opioid pain um, relievers. They are only used for pain that is severe and is not helped by other types of painkillers. When used carefully and under a healthcare provider's direct care, these drugs can be effective at reducing pain. So that the narcotics is kanang mo na siyang ginagamit pag na kay mga pain sa imong lawas para ma-relieve siya para makatulog kag tarong mga ngana. So kani siya kinahanglan japon og mga healthcare professional na mag-guide sa imuha para dili ka ma-overdose ani na drugs. So next is the inhalants. So inhalants are the various products easily brought and found in a home or workplace. They contain dangerous substances that have psychoactive properties when exhaled. So example aning inhalants kay kanang rugby, Vulca, like, di ba, kanang makita man na siya sa home, ng rugby, pampilit og kuan, ng sapatos, ana, so, um, kani siya, kanang suyop ni nila para maging active sila. So, next is the signs and symptoms of drug users. So, kani siya, makita ninyo siya sa mga tao na nagagamit og drugs. First is the enlarged pupils, bloodshot, or glassy eyes. So, muna mo makita sa mga television na ng pula ilang mata, ana. Next is increased energy and confidence, loss of inhibition, o nakabaloon sa iyo nakapanguna-una. The aggressive behavior, like kanang mag nang manumbag na laglaing tao kay di na sila kabalo mag-control silang sarili. Next is trembling, kurog-kurog, paranoia, hallucination, nang wala na sila kabalo unsay tinuod kanang mag-hallucinate na sila unsa na nabutang. Next is nausea and vomiting, nang magsuka, exhalation, fatigue, or insomnia, nang dili na makatulog, grabe ka active, and then anxiety symptoms. So next is the drugs cause or worsen other healthcare problems. So kani siya These effects occur when drugs are used or high dose or after prolonged use, and some may occur after just one use. So, gani siya, makita lang nimo ni siya kung permi nimo siya. Nagamit ka ng gina-abuse na nimo paggamit sa drugs, tapos ma-overdose na ka, magkaroon ka og liver function, mental disorder, infectious disease, cancer, heart disease, and lung disease. So these are the some disease na imong makuha kung dili nimo i-take ang drugs carefully, wala na prescribe sa doctor. So next is, and the last part, these are the reminders to those people not to engage in this such activities. So illegal substances are harmful to anybody, but they are especially harmful to a child or adolescent whose body is still developing. Illegal substances have the potential to harm the brain, heart, and other vital organs. People who use drugs have a harder time performing effectively in school, athletics, and other activities. It is frequently more difficult to think clearly and make good decisions. When people use drugs, they can do harmful action that can harm them or others. The best thing you can do if you suspect someone is using drugs is to alert an adult you trust. To stop using drugs, the person may require professional assistance. A responsible adult can assist the individual in seeking the treatment they require to quit using drugs. Another way that adolescents can help other kids is to refuse the attempt or use of drugs. It is a great method for friends to stay in touch. And these are the reference I've used in collecting information. So that will be all. So Vanessa Crisan signing off. Thank you.